I'd like to welcome everyone to the 17th Annual Allied Health Professionals Forum. This is one of my favorite days of the year. I look forward to it because of the excitement and the work and the information and the exchange of knowledge and the et cetera, et cetera, et cetera that everyone brings to this event. It's very heartwarming to see what everyone's doing, as well as just impressive and makes everyone else strive to do more, right? My name is Sarah Feldman, if you don't know me, along with Rachel Boothman. We're the co-chairs of this committee. That's what I do here. At home, I'm the physical therapist and assistive technology professional at the MDA ALS Center of Hope. We'd like to start out by thanking our sponsors. Cytokinetics is our principal sponsor, our longtime supporter of the ALS Hope Foundation, and Fight MND for the Wi-Fi. The Wi-Fi password is Perth with a small p 2019, and we'll be using the hashtag ALSSYMP, SYMP, throughout the conference to share on social medias. To start the program, we wish, is there a slide for the? Just say it, okay. We wish to acknowledge the traditional custodians of the land we are meeting on today, the Whadjuk people of the Noongar Nation. We pay our respects to elders past, present, and emerging. To start today, and to welcome all of you, we'd like to welcome up Dr. Dave Healey. And while he comes up, I'd also like to thank all the volunteers in the room today who will be roving with the mics, as well as the audiovisual people in the back.
Hello, Sarah.
Hello. Let's see. We practiced this.
I'm fairly new at the electric wheelchair a bit, and I was hoping to find a cure before I get too good at it. So anyway, we'll keep working on it. So welcome everybody to the Allied Healthcare Professional Forum today. I know I didn't get the words out in the same order, but I moved here from Canada about almost 5 years ago, and I worked in Canada for 15 years, and I was diagnosed with motor neuron disease, or ALS, January the 11th of this year, and it was really important to me to keep working because I've always loved helping people. And so I worked, and I did my last knee replacement on August the 30th. And so September 1st, I quit work. So in my mind, I've gone downhill quite a bit. And I wanted to start off today and say, the unfortunate thing is that I still think I had a lot of good years left in me to keep working. So I'll have to channel that energy into a different way. And although I'm an introvert as a person, when they asked if I would come up and speak today and tell my story, I wanted to give back. And I just fight back every bit of introvertness in me so that I could come up and speak. And I guess the one thing I wanted to say so once I got to July 1st of this year, it was my 20th year as an orthopedic surgeon. So that's why I fought really hard to get to July 1st. I probably could have quit a little bit before, but as anyone in North America knows, Wayne Gretzky is a famous hockey player. Ice hockey, you have to specify that down here. And so he's a famous ice hockey player. And he quit at the top of his game. He didn't go sliding out so that he wasn't doing good work. He wanted to go out on his terms, and he did. And I wanted to try to be the same, but I wanted to get till July 1st, it would mark my 20th year. I mean, nobody wants to quit at 19 years and 10 months of something. And the other thing of being an orthopedic surgeon, I work a lot with allied health, and I was always on the other side. So we work particularly a lot with, of course, our nurses and physiotherapists and occupational therapists. But we have a multi-team role as well. And first, when I moved to Australia, and I live in New South Wales, I worked in a rural hospital. And when I went there, the 30-day mortality rate of hip fractures was really poor. And so when I went there, I said, I'm not working in a facility where I can't hold my head up and do good work. So we dug in, we got a multidisciplinary team together, and we were able to, within 3 years, go from one of the poorest 30-day mortality rates after hip fracture in New South Wales, all Australia, till this year we became the best, the lowest 30-day mortality rate. And it really wasn't because of my surgery or my colleagues' surgeries. It's the multidisciplinary team that really made the difference. And that's one story, I just wanted to say, I know the Allied Health Forum from both sides, because roughly at the same time in, let's see, probably a little over a year ago, I was walking down the hall of the hospital, and I make a living out of people watching them walk. And I can always look at a gait pattern and figure out what's wrong, or even what joint is paining them. And all of a sudden, I'm walking down the hall of the hospital, and I could hear my gait pattern had changed. And I had a slap foot. And it was only slight, but I could tell, and I could tell the sound. We all know, if you work in a hospital environment, the long, narrow corridors, and you can hear yourself walking. And I can almost tell when I hear other people coming. I can say, that's Sarah coming there now, or that's, Lauren coming up behind her, And so anyway, I heard that, and I said, okay, I don't have time to go get my disc taken out right now. I'll do that later. And so finally it got worse and worse, and people even started to notice, because it's amazing how I was able to hide it. A lot of people, my orthopedic surgeon colleagues, didn't notice. The physios, OTs didn't notice. And it wasn't until then I really started to get a little bit off balance. And then I sort of said, you know what, I better go get this disc looked after, because it's causing a lot of trouble. So I went and had an MRI scan of my spine, and it was a horrible looking thing. I had a pars defect in my lower spine that I never knew I had. I have 2 big central discs out in my cervical spine from years of looking down an operating table and poor posture. And when I looked at it, I said, shit, none of that is causing my foot drop. So then I saw a friend of mine who's a neurologist, and she said, none of that's causing your foot drop. And I said, yeah. So anyway, we got a brain scan, an MRA, and look, we were looking for a tumor or a stroke or something. And anyway, the brain scan was fine. I was a little surprised by that. And so then we did all the nerve conduction studies, and they said, most likely, I had a neuropraxia in my right leg, because I'd flown from JFK in New York to Sydney. It was just after that. And I said, oh, thank God. And so she said, it'll start to resolve and start to get better. And it didn't. It got worse. And right away, as an orthopedic surgeon, I knew what was wrong. And it was a horrible feeling. And then I didn't want to tell anybody, and I didn't really want to get the real diagnosis, because once I did, I was going to have to tell my wife. And then the toughest thing, I have 2 young daughters. And I said, I'll keep it quiet. And so my neurologist called and said, are you going to come in and see me for our follow-up? And I said, not till after Christmas. Because so long as I didn't know, I didn't have to tell anybody, and it's not in the forefront of your mind. And then finally, I went back, I told her, I'll see you after Christmas. So I did. And we sat down, and so my neurologist was there. She said, you know what's wrong, don't you, Dave? And I said, yeah, I've got motor neuron disease. And through the course of it, as we're going, and my neurologist is a good friend of mine, and she started to cry. And then I went over to her and I consoled her, and I said to her, hey, I'm good. I said, you know what? I said, this bastard picked a wrong person to pick on this time, right? Because I'm not going down without one hell of a fight. And I said to her, I'm going to die one day, but not every day. And I ain't dying today. So I said, I'm just going to take every day and keep on fighting. And so anyway, off it went, and it started to get worse. And then I told my wife, of course, and that's quite devastating. Your life is never really the same after that. And then she said, when are you going to tell the girls? And I said, never. And then she said, wait, they're going to notice at some time. And so we have a daughter here in Perth in medical school, and the other daughter's in Melbourne, and she just started her first year, and she's doing exercise and sports science. And then she wants to go into physio, and she wants to do a massage as well. So I said to my wife, I'm not telling them before they go to school, each one of them starting their first year. I said, because I know my daughters and they'll stay home. So anyway, I then said, let them go. So we let them go to university. They got their friends and their support networks and everything. And when they came home for Easter, it was the toughest thing I've ever done in my life. I've put people that have been split in two back together. And, you know, it's just what I did. I'm like a trained monkey. I was trained to do something, and I just do it. And so then, you know, all the other help, but the toughest thing was telling those two girls. So anyway, we did it, and I gave each one of them a project. I said, don't. First thing is kind of funny, because Drew said yesterday, his neurologist told him, don't look at the internet. And I told my daughters the same thing, do not look at the internet. And I knew through all my training and patients I'd seen, I knew what ALS, motor neuron disease, was and what I was going to go to. And I said, I'll let you know things as it goes along, but you don't have to read up on it. And those little girls broke their heart. And so one of them, I said, the one in Melbourne, I said, get in touch with Fight MND. You're only around the corner from them. So she went and she got in the run, and she raised almost $39,000 for Fight MND. And then the other one that's in med school here in Perth, I said, now I'm going to charge you with helping to find a cure. So I said, you can't do yours as easy yet, but anyway, that's what you'll do. So anyway, I've always said, as Allied Health comes and been an orthopedic surgeon, that it takes a team to beat anything. And now all of a sudden I'm on the other side. And I have a family doctor that helps me. I have a physiotherapist, my occupational therapist, and they're spectacular people. They make me safe. They take care of me. They give me ideas that I never thought before. And they're going to help me keep going further, longer, so I can now go from being an orthopedic surgeon to being an advocate for motor neuron disease. And that's what I'll make my mission. And I have a speech pathologist, the dietitian. I have a lot of people helping me. And I'm very thankful for every one of them. They have no idea how much easier and better they've made my life so far. And to all of you, if I can be a bit of inspiration and kick off your day and say what you do is really, really important. I don't need a surgeon right now. I need OTs, physios, speech pathologists, dietitians. We don't have RT up our way, but anyway, I'll fix that anyway. So anyway, good luck in your day, and I hope you take away lots of things, and I hope you go on and help and inspire many, many people in the rest of your career. Thank you.